Lie down. It will help to lessen the likelihood of shock if you can elevate the legs or position the head lower than the trunk. Check the victim's breathing and circulation before proceeding. Elevate a wounded limb. Raising the wounded limb, assuming it is an extremity that is injured, above heart will help to reduce severe bleeding. If you suspect a broken bone, however, do not attempt to move the limb. Remove any debris. Clean up any visible foreign body and dirt, but do not clean the wound thoroughly as this can aggravate the wound. Your immediate priority is to stop severe bleeding. Cleaning the wound can wait. If the foreign object is large, however, large piece of glass, knife, or similar, do not remove it. It is most likely stopping a lot of the bleeding itself. Just put pressure and bandage around the object, taking care not to push it in further. Apply firm pressure directly to the wound until the bleeding stops. Use a pad of clean gauze, dressing, or clothing. Even your hand can work, if nothing else is available. Place your hand over the pad, and apply firm pressure with fingers, or a hand to the wound. Apply pressure steadily. If the injury is on a limb, you can use tape or cloth wrapped around the wound to maintain pressure. A folded triangular bandage placed over the wound and tied is ideal. For groin or other parts of the body, where you cannot trap the wound, use a heavy pad and keep using your hands to press on the wound. Look for seepage from the wound. Add more gauze or additional bandages if the original soaks through. Do not overwrap it, however, as increased bulk risks reducing pressure in the wound. If you suspect the bandage is not working, remove the bandage and pad and reassess the application. If the bleeding appears controlled, maintain pressure until you are sure the bleeding has stopped or medical help has arrived. Use pressure points if necessary. If you cannot stop bleeding by pressure alone, combine using direct pressure to the wound with pressure to one of these pressure points. Use your fingers to press the blood vessel against. Continue applying pressure until the bleeding stops or help arrives. Use a tourniquet if the bleeding is life-threatening. How and when to decide to use a tourniquet? Home remedy right bar tourniquets usually stop bleeding instantly if applied correctly, but incorrect tourniquet use can harm the patient. Monitor the breathing. Check that the bandages are not too tight. If the victim has cold, pale skin, toes, or fingers that do not restore to normal color after compression, or the victim complains of numbness or tingling, it is probable that the bandaging is too tight.